Today, I've got my good friend, Phil White, our expert physiotherapist, back, and we're going to chew on a question that came through from one of our YouTube subscribers, actually, that asked us what the best exercise is for lower back pain. We have scrolled through the comments and found one that we really do feel we can give some good value on. Now, we like to say that there is never one single exercise that can fix a problem. So today we're going to give you some context around lower back pain. I'm going to ask Phil about what common causes are, and then we're going to build a bit of a strategy that we would take for the majority of people.
Welcome to our podcast, proudly brought to you by VPA Australia, our trusted supplement provider since Unity Gym started. As sponsored athletes, we're excited to offer you a special 10% discount on top quality supplements that ship worldwide. Just use our discount code from the description. To avoid international shipping fees, contact VPA and tell them we sent you to get a flat shipping rate. Today's episode is also sponsored by the Flexibility Blueprint. Ever felt lost in the sea of social media fitness advice? The Flexibility Blueprint is your map to progress, designed to help you get laser focused on what matters most for your journey in flexibility and strength. And guess what? It's free. Grab it using the link in the description. If you're starting your flexibility journey, don't miss our 20-minute mobility routine. It's your first step to quick wins in flexibility. For those further along, use our Flexibility Masterclass, featuring advanced techniques like loaded stretching and end range strength for the pancake, front splits, middle splits, and more. Links for both are also in the description. And for the seasoned athletes, avoid the frustration of complex training puzzles with our UMS Tribe membership. It's a different online coaching experience with strength and flexibility combined. Don't forget, we're Amazon affiliates too. You can find all the equipment used in our videos and podcasts at the most competitive prices with our affiliate links in the description. Now let's dive into today's episode.
Phil, how are you today?
Yeah, really well. Love talking with you on the podcast, and particularly like lower back pain is such a common challenge. It's one of the main causes of pain and disability worldwide. There's absolutely like the cost to society generally from back pain is so huge. So yeah, the more we can share information that will hopefully help people, the better. And yeah, I'll get my disclaimer in early, as I often like to do, is if you do have injuries and pain, do work with a professional one-on-one. If you're getting information off the internet, like use it to inform you, but really you do want to make sure that you are working with someone directly if you do have an issue. So
yeah,
now that's out of the way, let's get stuck in.
Yeah, look, I think a good place to start this discussion is the different ways that people can experience back pain. For me and Rad, it was after an acute injury. I fell off a horse and was dragged. The length is debatable. I felt like it was a long way. Rad thinks it's about 25 to 50 meters on a gravel road. Anyway, long story short, it caused some pretty bad damage to my lower back. And that seems to be the trigger for my lower back pain. Now, in my mid 40s, from time to time, I still experience problematic back pain, but my go-to remedy is movement, exercise. And I found that my back pain only became manageable after I built a higher level of strength. And there are lots of different things that we can talk about as it relates to that and my strategy. But there are people who are going to be watching this who have found themselves experiencing lower back pain. Like, for instance, my father, who doesn't exercise, who hasn't had a fall, who hasn't experienced an acute injury. And he experiences, from time to time, quite severe lower back pain. At one point, it was causing quite, debilitating sciatica down his leg. And, he's, arrived at that point from a very different series of events or history than myself or Rad, who had a fall in the military and experienced a pars fracture. And he's got I think it's referred to as a spondylolisthesis or pars defect in his lower back, which looks pretty ghastly when you look at the x-rays. Then you look at his movement though, and he's such a perfect example of structure, not necessarily dictating function. Yeah, cool. So, why don't you first of all, why is it, I want to ask you, that some people experience lower back pain and they have never, hurt themselves? Like, there's never a noticeable mechanism that they were fine, and then they did this thing, and then all of a sudden they're experiencing back pain and they can't seem to get rid of it. Why do some people just arrive at a point in life where they start to get lower back pain?
Yeah, so I mean, life is so multifactorial. It could be any number of things, but just to share my own experience with it, like you guys had your sort of traumatic acute injuries, whereas for me, I had back pain from a very young age. From basically I remember about when I was 13 years old, my mum taking me to get like remedial massages and osteopathic treatment because back pain was such a problem for me at that time. And so I was playing sport at the time, but it certainly wasn't due to any acute injury. It was just at that stage, the suggestion was it was like related to the fact that I was growing very quickly and just the muscles hadn't quite kept up with posturally. So for me, that was a big issue. And then I also had a sciatica, a scoliosis as well that impacted just made me more susceptible to back spasms. So there's, different factors that can lead to it. But I think the most important thing to realize is the back, I think people think of as this, silly design, and that it's like, not, the like disc issues are such a big problem, and that it should be designed better almost. But really, it is such an amazing structure to be able to allow a whole lot of mobility. The fact that we can, bend forward, touch our toes, lean right back, rotate, turn to the side, and all the while also being able to maintain, plenty of axial load, so the ability to carry heavy weights, lift heavy weights, but then also it can absorb a whole lot of impact. So when you're running, jumping, all of those things, you've got this amazing structure there that is capable to do everything. But just like any type of structure in the body, like it's all about dosing when it comes to what load you're prepared for. So I think the fact that people injure it in different ways is especially once you're past childhood, if you had an active childhood where you're doing loads of different activities, lots of different sports, you've got a lot of movement variability, you've got a lot of exposure to different types of load and movement. So that's running, jumping, changing direction, all of those things. And then suddenly you get into, your 20s, 30s, you're sitting down a whole lot more, probably doing a lot less. And then as like your body adapts to what you spend your time doing. So all of the structures in your back, whether it's the bones, the ligaments, the cartilage, all of these factors, and then the muscles will get pretty used to what you spend your time doing. And as soon as you do something outside the norm, that's where you can just have that moment of acute overload and then run into issues there. So unfortunately, we don't all live lives where we're getting like very wide-ranging exposure to strength, mobility, fitness, impact tolerance, all of these tissue tolerances. We live generally pretty like reduced movement and exposure lives, and then suddenly it's just doing something outside of that can really trigger an event because that's what we've adapted to.
So you can essentially, you're saying you can experience one instance of an injury, a trauma, too much load, excessive load that's beyond what your lower back can handle, but you can also do it from multiple sort of instances, a build up, like sitting in a chair for too long and not getting up and moving around to change the position of the body could overload the lower back over time, things like that.
Yeah, I mean, there's so many different structures involved, and certainly with sitting for long periods of time, the human brain and body is very good at conserving energy, so we'll generally just rely on using more of our passive structures. So their structures don't take energy to contract, so it's going to be, hanging a bit more on your ligaments, compressing a bit more through your discs, all of those things, and that's like a smart thing for your body to do because it's trying to conserve energy. Because we were really our body evolved in a time where it was hard to come across calories. Now it's a bit different these days, but we still have these sort of same drivers internally in there where we want to basically, like by sitting for long periods of time, you'll generally, ride those passive structures a bit more, and through not loading our muscles in that time as well, we start to get deconditioned. And so then if you go changing from spending a lot of time where you've deconditioned those structures and probably overloaded the passive structures, suddenly, picking something off the ground, which isn't an inherently dangerous activity, but because you've just not been as exposed to those particular movements, or, you've sort of predisposed yourself via like inactivity for a long time, it's like what used to be like what probably shouldn't be it's not a dangerous activity in and of itself, but in the context of a life without much movement variability, it can be enough to just set things off.
Awesome. So let's then move on to what people can do and what we would recommend people can do if they've got lower back pain. And there's, of course, a massive spectrum here. And I'm sure you're going to start with the caveat of get yourself diagnosed first, tick off certain boxes, because there are variables. So let's start with that. What are the different sort of variables and risk factors here before people start to go, okay, all I need to do is just exercise or move more?
Yeah, so I think like the back is, all areas of the body, like there's a reason why you want to see someone who can help with diagnosis, because just because you have pain in an area doesn't mean that it's going to be like the most obvious structure that's causing the issues. So for example, like in the lower back, you might sort of have a pain where you're like, oh yeah, it hurts around my SIJ, so therefore I think it's which is your sacroiliac joint, part of your pelvis. So people think, okay, it's a SIJ joint pain issue, or you might have pain down the leg that's causing issues, but really you've got other structures that can basically refer pain elsewhere. And then obviously as well, you've got the neural components as well. So if you've got back pain, it's a site that you really want to be quite careful with, because obviously when you have a structure that's housing the spinal cord, any things like tumors, all of these like non muscle related and non basically like red flag signs. And so that's why you want to work with a physio or a doctor or someone who can help you go through and screen, like find out, are there any, there's quite different questions that we ask for screening to just make sure that like there's nothing suspect going on there. And then if there is, they'll often send for scans. But it's really important to start with that, because basically in that lower back pain area, you have a lot of other structures that could suggest there's something a bit more serious going on. So that's why it's so important to like definitely make sure that just because you can point to it and it's in your lower back doesn't mean it's a necessarily like a classic sort of musculoskeletal lower back source of the issue. So
okay,
might sound heavy, and like most people obviously won't have that, but it's just one of those things where it's like you just really want to make sure you're starting with that.
So if we can rule that out and we know that there's nothing majorly sinister there, there's no risk of nerve damage, things like that, then let's talk a broad approach to getting people sort of started, getting people off the floor or off the couch and first steps. I know that you often talk about the fact that there are certain positions the body will like more, depending on the type of back pain?
Yeah, so backs are really classic for having what's called a directional preference. So basically, like, with the different movements of the spine, so you've got flexion, extension, lateral flexion, which is basically bending to each side, and then rotation. And it's really classic with back pain to have a directional preference, particularly in that sort of flexion or extension direction. So that'll often mean like, and if you've had a pain where often like a deadlifting pain, a pain that if you got from starting deadlift, being in that lumbar flexed position while lifting, often then that, might lead to an issue where you have a really hard time bending forward, being in that flexed position. So all of these things give us really good clues about the structures involved, but also just, it gives you a bit of a roadmap as well about how to manage the pain. Because I think the most important thing to remember with the classic sort of lower back pain, and that's putting aside any sort of fractures or of those red flag signs, is like staying moving is just so important, because it's tempting when it's your back, it's so hard to ignore, as you've I'm sure experienced, like that you just kind of can't escape it in the same way that you could almost ignore your ankle if you've rolled your ankle, and it's can be really painful, but it doesn't get involved in basically like everything you do. So it can be really hard to ignore, and then people get really freaked out because obviously the ramifications of a back pain, like serious injury, are pretty threatening. So it's tempting just to be like, okay, I've got to rest as much as possible and not move and be super careful. But if you've I've spent some time in the emergency department as a physio, and you see people in there with like acute back pain, screaming with movement, but like the first thing people are trying to do once they've screened it to make sure that there's no sort of red flag signs is really like, can you get moving as soon as possible? Because it actually just leads to far worse outcomes if you're being as like if you're staying stationary, basically. So the old motion is lotion, which do you guys still have that merch?
We sure do.
Nice.
Yeah,
so
we sure do.
Yeah, the getting moving is just one of the most important things you can do.
I actually had an anecdotal experience recently with this positional directional preference concept. We were speaking a couple of weeks ago, and I had a little bit of a flare up in my lower back pain, and it comes and goes, and lately it's been there a little bit, and you made the suggestion to go to the gym instead of doing low bar squats and high bar squats, to do front squats. And I've been doing that ever since for the last couple of weeks. And it completely changed the dynamic of how I was loading the lower back, and it's giving it a chance to settle down whilst I've still kept up my training. And it's really funny. For me, it's so obvious. I mean, to the average person, it won't be, but to me, being in the fitness industry for 20 years now, you just go, oh, what an idiot. I should have thought about that. You know, the front squat keeps your body more upright so that you're not hinging forward. So you're not putting as much load on the lower back. And I was actually doing low bar squats to strengthen the lower back, but I was probably just doing a little bit too much, you know?
And I talk about it, I feel like almost every episode, with those 5 variables of strength training, which is going to be the level of resistance, so how heavy the weight is on the bar, the volume, so sets, reps, rest in between, and frequency throughout the week, then your range of motion, your speed, so how much control, and then the complexity and exercise selection. Like, these are the 5 things that they can tweak. And what I always try and get with patients is, like, in the same way that, you know, often there's a directional preference, there's also often like clear aggravating variables that if you just remove that one thing, you could probably still keep a lot of the other variables up, while just reducing that most aggravating. So for you, it wasn't so much like intensity or volume by the sounds of it. Range of motion like might come into play if you're going a bit, but really wasn't so much range of motion and not so much tempo, but it was the exercise selection and just choosing, like, we want to have a, you know, squat pattern for you because we do still want to, you know, in your context, like load the spine and keep your legs strong and all those things. But for you, it was that sheer force that comes from being in that low bar position where you've got the direction of the forces on the lower back was aggravating. Whereas if we could change that exercise selection and still keep those other variables up, we could just make it more of that compressive force, which you were much more it wasn't anywhere near as aggravating. So it becomes really like, that's kind of one of the key things you want to look at, is like, it's not the exercise that hurts you, it's just often one of those variables, and there's always things that you can tweak there and stay as close to regular training as possible. And obviously that's great for like structurally keeping everything else strong and supporting the lower back, but also mentally, like the psychology of lower back pain is so huge. Like it stops you from going down that like downward doom spiral of like, I'll never be able to do anything physically active again, which I've definitely fallen into when I've had severe lower back pain.
Yeah, this is where I want to take the conversation now. So, you know, we've built some context around the different types or causes of lower back pain. We've also made it very clear that there are certain things that you do need to tick off before we progress with movement. But in the case that you are all clear and you've had that session or support from a professional who can guide you, a physical therapist or physiotherapist, you know, or someone who's at least in the know, an expert. And then from this point, we want to make it clear that motion is lotion. And in most cases, some form of movement is going to be the best thing for you, as opposed to sitting still and sedentary and not moving and avoiding exercise.
And from that last example, don't think that it is, you know, you have to go do high bar squats. Like, often if you're in that acute phase, like just getting walking, and even for chronic people, if they have stopped doing things, like just simple walking is generally one of the best things you can do, particularly if with the directional preference, if your sort of flexion is aggravating and extension is nice, then walking kind of puts you in that back extension is often quite easing. Now, if you're extension aggravated, that might be slightly different, but that's where having someone to help you guide you through what those activities might be. But for them, it might be actually sitting on a stationary bike or a bike itself, because that puts you into more of a flexion position, and then you can get moving and have all of those like positive metabolic and factors that come with exercise, both like endogenous opioids, it's basically the natural like in your body painkillers that happen, and just, you know, keeping yourself in a really like healthy metabolic state as well, so you're not falling into all the trappings of sedentary unhealthy life when you stop exercise. So and this is, I think, where I want everyone to pay attention, and I think this is probably the most valuable portion of this discussion, which is that the concept of how your body perceives deals up pain based on perceived threat, and what exercise, a regular exercise, does to that whole system. So I guess where I want to take the conversation, where I want to finish, because we can chew on this for a while, is this concept that the same person can have
the exact same person, if split into two different lives, one is exercising regularly, one isn't, can have a very different pain experience. You know, if let's say hypothetically we've got two identical twins with the exact same back pain, one of them's exercising regularly and one of them's not. The one that's exercising regularly will most likely have a much lower pain experience than the one that's not. And I want to explain, I want to try to give people a bit of an understanding of why that is, because this is something that's helped me quite profoundly. You know, adopting this mentality of exercise is a critical component of my overall health. The reason why I exercise is very different to a lot of people. It's mostly for mental health. That's what got me started. But then I've continued to do it for pain management, for aesthetics, for all these other great things that happen from it. But what I noticed personally is that when I was avoiding weightlifting, you know, movements like the squat, like the deadlift, chin up, bench press, things like that, my back pain was really hard to manage. And when I adopted those styles, I went from just doing a lot of boxing, because I grew up doing combat sports and boxing, and I had a lot of problems with my back. Then I went to strength training as well, and then later flexibility training and having a focus on balance between my mobility and my strength. And now back pain is very, very rare, having symptoms of back pain. And usually as you age, it gets worse. You know, your pain symptoms get worse. I've at least observed that in my father. So I am a very strong proponent of recommending exercise for people, but managing load when they experience lower back pain. What are your thoughts on this, and what would you
there's
suggest?
so many different directions to go with what you said there, and I actually want to even back up just for when we're talking about like going and seeing someone for help with this stuff. Like, this is where people get so frustrated, and, you know, me included in the past, and even now, like, it is so challenging because you can talk to people who are very well regarded, very like you know, professional. They've had qualifications and experience, whatever, and you might have exactly, you know, you'll have the same presentation and you might see 4 different people and get 4 different advice, like pieces of advice on what to do. And so that obviously is like really frustrating for people when they come there. But the thing to remember with the human body is it's so complicated, and that's partly physically what's happening and our ability to, I guess, understand structurally what's going on. There are certain limitations, like MRI scans can't tell us everything. Movement tests and these sort of special tests we learn as a physio aren't as like specific sometimes as we, you know, originally hoped. And palpation skills, like, you know, i.e. touching and pressing and figure out what it is. And you'll have some people who talk with a whole lot of confidence saying that they know exactly what's going on, but it's like really tricky because there is just so much variability structurally. And then, as you said, with this, you know, example of someone like 2 twins who've had like the same, you know, structural injury but have totally different responses, there's also going to be this massive influence of the psychological and what's happening at a neural brain level as well. So the thing to understand with all things injury and and the human body is that there's always going to be that structural component, and there's always going to be that the brain component as well. And there's like infinite arguments, like ongoing arguments about this in the profession. And there are some people who are super on the structural side of things and on the what's called like the kinesiopathological model of pain, where it's all about like, you know, if we just get the right combination of you know, biomechanics and movement, then it'll solve all problems. But then there's probably people who are also like way over on the other end of the spectrum with like, everything's about pain science. It's all about how you think about your injuries and all those kind of things. But like the answer is somewhere in the middle, where it's like, for some people it's going to be you know, the structural side of things and getting the right combination of exercise and dealing with load management, looking at exercise technique, all of those things, and some, you know, some rehab style exercises are going to be really helpful. And then for other people, it is going to be more the psychological. And sometimes the people who have the psychological challenges are helped by just getting a plan and treating it physically. Because, you know, with all things pain science, and I don't know if we'll have time to go into again, but what you said before about like pain is your body's expression of perceived threat. And so it's taking information from the body. You don't have pain nerves, you have information nerves that tell you about touch and temperature, and there is like a damaged one as well. But you have all these different nerves that are sending information that's going to be modulated at the spinal cord level for, you know, so your inflammatory state, your hormonal state. So if you're in a high adrenaline state, it's going to turn down the volume on that signal. If you're in a pro-inflammatory state, it's probably going to turn the signal up. And then at the brain, your thoughts, moods, belief, and context are going to all inform how your brain then processes that information from your body and then turns it into a pain experience or not. And that's, again, not to say it's all in your head. It's not to say that you can suddenly think your way out of this. And sometimes you do need like that physical proof of doing exercise and showing your body, like showing your subconscious brain that your body is capable and it's not in complete threat. But it's really important to understand that there's going to be like a unique sort of like fingerprint for each person and their in their life. Like, how much of it do we have to deal with just the structure, and how much do we have to deal with like the understanding around it? And it's sort of interesting you said before about the idea that like the person who's doing exercise versus the sedentary twin in this case, like the exercise twin is going to be better off. But really, like, I've seen it so often that that's not the case. And there was I can't remember exactly what study I was looking at, violinists and their pain experience. And basically, like, if a professional violinist gets a paper cut on their finger versus someone else gets a paper cut on their finger, like, most people, wouldn't really care about that paper cut. They wouldn't really think about it after the initial like sting of it's gone. But for a violinist, where like so much of their identity, so much of their professional well-being, their artistic expression all comes down to being able to use that finger to be able to, play on their violin. Like, suddenly that pain, that their like brain is going to have a magnifying glass on that paper cut, and it's going to be turning up the volume on that, like all the signal that's coming from there. And obviously they're going to be probably aggravating it if they continue to play. So that same like structural damage can lead to a completely different pain experience compared to someone who, doesn't use their finger for that. And so for someone who exercises, and this is something I see so often, and I work with a lot of, elite athletes, and if you have an injury as an athlete, like, and that stops you from doing exercise, participating in your sport, being around your community, if that's the area in your life where you really like excel and you see progress and you like that is such a big part of your overall well-being, then that bit of back pain can suddenly be super threatening. You're going to have a magnifying glass, and every time you do anything, it's going to be, like, is this going to make my back worse? Whereas someone who's pretty sedentary and, like works at a desk and plays computer games all weekend, like obviously it might be achy and painful, but it's not going to be as like threatening. So there's always going to be that kind of particular life, fingerprint of each, how much of it is, what someone experiences.
Yeah, right. That makes a lot of sense. Okay, so let's say we've got a person who's watched right through, and they have identified that they suffer a certain type of back pain. It's caused by something that they can sort of they've got a good understanding of the cause. They've got a good understanding of the severity, and now they're at a point where they want to, and they agree that exercise movement is going to help them. It's going to be beneficial. So they're going to take that step. Now they need to understand, and I think we should finish on just those different loading variables that we brushed over earlier, and what you can do when you're working out to have, the levers you can pull, the buttons you can press to have a very, very different outcome, and it all is going to come under that umbrella of load management and making sure that what you're doing suits where you are on your journey, and not the person that you've teamed up with, that you're training with, your training buddy who may not have any back pain at all. And they've just said, yeah, come with me because I know my way around the gym.
Yeah. So I think the first thing to do is really have like a good grasp on your symptoms and what your sort of baseline symptoms are going to be. So really having an understanding, like, okay, on a regular day, like, I might wake up with pain and it's going to be at like a 2 out of 10. And then at like, if I train, it goes up to a 5 out of 10 or whatever. So you're probably starting out with that like general understanding, but really starting to get a bit specific about the 24-hour pattern of the pain. So is it worse in the morning? Is it worse in the end of the day after you've done a lot? So you want to kind of have a good grasp of like, what's your baseline? Because every like rehab experience is going to be kind of an experiment, like a scientific experiment, where we're going to change variables and then see if there's a response. So like getting an understanding of your baseline pain. So how sore is it out of 10? And then adding in these two other bits of information, which is going to be how quickly does it come on? So is it an instantaneous sort of thing as soon as you do the aggravating factor? And then how quickly does it settle down once you remove that aggravating factor? So having an understanding of those three elements, plus thinking about the quality of pain. So whether it's a sharp pain, a dull ache, a pinpoint area, a big diffuse area, if you're getting neural symptoms, all those factors. And so just getting like an understanding, so you're not just like, I'm in pain. You're going to have now a few different like bits of information to look at, because then under the guidance of physio, ideally, you want to then, with your exercise, get really that same level of like granularity around what are the exact like inputs that I'm doing here in my exercise. So understanding those 5 variables, if it is strength training, so how heavy the weight is, the volume, the range of motion, the speed, and then which exercise selection you're taking, or the complexity. And so understanding like those factors then gives you a chance to, with each of the different exercises you're doing on that day, like tweaking those and playing around with them to figure out, okay, like if you know, for example, that you always get back pain when you squat, and that squat, like that pain usually happens when you've done, say 3, or like as soon as you get into the bottom of a arse to grass squat, or and it happens pretty instantaneously as soon as you're in that position, then you might think, okay, like that pain, like if I just go to say, thighs parallel, like can I still keep my like resistance level, so the weight in the bar quite high? Can I still keep the volume quite high? Can I do nice slow controlled movement so I know exactly where my end of range is? And maybe you might choose a slightly simpler version of a squat, like a high bar, for example, as opposed to, I don't know if you're doing Olympic lifting, for example, but like just by changing that range of motion variable, you might well be able to still get a lot of the benefits from your training experience without getting that aggravating factor. But you basically want to like have an understanding of with each of the exercise you're doing, those variables, so that then if you do make it, like if you do aggravate it, then you can pinpoint exactly which factor it is. And obviously you want to test this like quite conservatively, depending on, especially if you're in the acute phase, like you really don't want to be like, sweet, I'll just go really heavy and, and make it, and just go nuts. And like you want to, but this is the kind of process that we go through to try and figure out, okay, like which variables are aggravating, which exercises are aggravating, and then can we stay as close to regular training? Because there's been plenty of research looking at like specific back and core activation, transverse abdominis activation stuff versus like general exercise approaches, and generally it's kind of comes out in the wash that like it's kind of doesn't matter what you're doing, it's generally going to have the same result, and obviously there's going to be like it's going to depend on like case by case, but as a general rule, like conventional strength training, if done appropriately, is going to be really effective at keeping going, and it's also a whole lot more fun and a whole lot more satisfying generally than doing these little dinky rehab exercises where you don't even know if you're contracting the right thing. So that'd be my recommendation, is like have an idea of your baseline with the exercises. Have it like before you get into it, you'll probably have a sense of you'll know which ones are likely to be aggravating, and then test those variables, and then have a look at like, does that have an effect on your baseline pain? So do I wake up the next day with more pain? Do I get an increase in the number? Do I get an increase in the like how quickly it comes on, and does it linger for a long time? And certainly that lingering one is the one that I generally am most sensitive to. Like if something's lingering for much longer, you really want to back off whatever you've done that time before. So it's a sign that you've probably caused a bit more like an inflammation in the area, and that's a bit more sensitized.
Amazing.
I mean, there's so much more to it, but I think like that as a general kind of way of looking at it is probably most practical and actionable.
But that last point is relevant to both an absolute beginner who's taking this step into exercise with back pain, also someone like myself who has been exercising for decades and needs to make sure that we're doing things that don't set you back, that are still bringing you forward. And lastly, I think it's you that said this first. Rehab is not throwing someone in the naughty corner and completely changing what they're doing. Rehabbing an injury is training in the presence of an injury. And so how do we figure out what we need to adapt to keep your program as close as possible to what it was?
Yeah, I think the naughty corner was me, but the training in the presence of injury, I think, was Phil Glasgow, who's a really well-known physio. But yeah, that's I think just such a key thing for like my own experience and my evolution of starting in healthcare, thinking you have to go down the like what's always been done, but we've seen over the years how much that's been shifting to being more of like a holistic strength and conditioning approach, rather than like for one you'll get better results, but two, it just psychologically is so much easier to stay engaged than if you're like completely torn out of like what you love doing, and you're told to do something entirely different. And just the last thing on like an approach that I like to take with dealing with injuries is like, I have a mantra now whenever I'm injured or working with patients, is like every injury is an opportunity. So figure out like if there is something that you absolutely love doing, like if you were on an absolute roll with deadlifting and you're going for this big PB, and now you have to adjust your plan because of this injury, like what's something else that you can do? And I always try and think like, what am I really bad at? Because one of the most depressing things with injuries is when you suddenly lose that sense of progress, when you feel like you're getting nowhere and you're going backwards. And something so powerful to the brain that helps us, like when I talk about like when I think about pain science and this sort of injury identity of becoming like obsessive about the injury and doing everything you can and trying to do exercise every day to try and fix this thing, but you're always just like got that magnifying glass on the injury. Like I think about it like having a big tab open on your computer where it's just blocking everything else you're doing, and you're trying to look around it and get your work done, but there's just this like pain tab open because you've just become so obsessed that you're always, it's just there. So like the way to minimize that is to find enjoyment and feel progress in other areas. So I was trying to think like, okay, what am I really bad at? Because I know if I put any amount of effort into that, I'll get like outsized returns and like outsized benefit from just doing that thing that I'm worst at, and I'll get really fast increases. So I was on a real roll with running and really improving my sprint speed and VO2 max, and I was like really gunning for it, and then busted my ankle just walking down the street with my baby, and couldn't run for a few weeks. And so that was a good like chance to get back into the gym, which I hadn't been doing as much of, and had some really satisfying progress in my legs. But in the past, I've done that with, when I've been strength training, like getting into things like cardio, or, if you're, so just trying to find something that's like where you can feel that positive momentum, because then with your pain being your brain's expression of perceived threat, it's really hard to feel like your body's under threat when you're making like obvious tangible progress in an area. So
yeah, look,
that would be
speak from experience there. When I had my knee reconstruction after a football injury, soccer injury, I was terribly down, but momentarily, and then I was blessed at the time by having Sebastian and Cameron Orob training in our gym at Unity Gym and coaching people out of there. And Bass said, why don't you, do a bench press specialization program with me? I'm trying to get to, I think at the time he was trying to get to a 200 kilogram or 220 kilogram bench press or something. And I said, I set myself a goal of getting 140 kilogram bench press. And that was great fun. I didn't need to squat heavy or deadlift heavy or anything while I was rehabbing my knee, and I busted it out, and I ended up getting a 146 kilogram max 1RM bench press from that.
And I had the same experience with Bass when I tore my hammy, and I was training with him really, really seriously, and that really put the brakes on my fun deadlift progress. But it was then a bench press specialization program, put 25 kilos on my bench, and it was the first time I didn't have any pain from my slap tear. So it was like that. I was so like frustrated that I couldn't keep making progress on what I was doing. But then suddenly it's just like giving you this opportunity to really like make great grounds in somewhere else. And you just never know the benefit you're going to get from, trying something new. And I think it does have such a strong impact on your sense of like well-being and progress and satisfaction with training if you can be making progress. So like keep that healthy momentum going, and that's going to make it easier to sleep, manage your stress, keep eating well, all those factors that then play a really like very real role in your both the kind of metabolic health that has an impact on your pain experience, and then also structurally just keeping yourself conditioned and having lots of movement variability and everything in there. So
awesome. So look, the last thing I want to say for everyone who's made it this far is that this is such an important final point, which is that if you are an exercise enthusiast and you are watching this and you're suffering some back pain, then make sure that you find an expert, a physiotherapist or physical therapist who has skin in the game in this area. If you want to keep exercising, if you're a runner, if you're a cyclist, then try to find a physio who also runs or also cycles or does triathlons or adventure races. And there is always someone in that space that you can get help with. If you're a gym enthusiast or a CrossFitter, then find a physio who does that sort of sport as well, because they're going to understand the needs, your expectations, and really be able to help do what Phil's doing here, which is teach you how to train in the presence of your injury and not remove you from it altogether. Where can they find you online, Phil, if they want to work with you?
So my Instagram handle is next to my name there, which is at Phil White Physio. And then let's see if we also have the ability to bring this up. philwhite.me is my website, nice and simple, just my name, Phil with 1L.me. And I'm just in the process of launching a whole bunch of new stuff. So do check it out, from free through to paid stuff as well. So
yeah, and it is such an important thing to understand that with a physiotherapist, you do not need to be in a clinical environment. You can work with them online. I've always been amazed with how Phil, and when we used to have both of you and Nilesh working in the gym, it looked like you were just writing programs for people and correcting their exercise technique and all this sort of stuff, much like a personal trainer or an exercise sports scientist would. Phil has an exercise sports science degree as well. So he's
But I also have a real, I was a remedial massage therapist. I qualified over 12 years ago now. And so like there is a real place for the hands-on stuff, but particularly in these areas where it's like not an acute injury, it's something that's going to be lingering for a long time. Like it so much of it does come down to, really just preparing your body for activities, and preparing your body for activities means, getting in the gym, doing cardio, like all of these things. So, certainly like there's a role for hands-on, but I think like, the online space is just perfect because it gives us the chance to, have that time and space to really explore a lot of the different kind of multifactorial aspects of this, not just be kind of distracted by trying to get that quick win of like, are you 0.2, like, are you 2 out of 10 better pain experience by the end of the, hour-long massage that you paid a lot of money for? It's, it gives us that chance to really, look big picture.
Awesome. That's all we've got time for today, guys. Thank you so much. If you've made it till the end, please like and subscribe if you're on YouTube, and also subscribe to the podcast and try and share this. If you know someone with back pain, it might really help them. Thank you very much, Phil. Hopefully we can continue the discussion next week. And guys, get your comments in. If you want us to speak about something that's relevant to you or specific to something that you're experiencing, then throw a comment. We do scour these every week, and that's generally how we choose the theme for each of our podcasts.
Before you go, am I right in thinking you guys have just done something quite new with the 4-week challenges?
Yeah, we've launched a 28-day strength and flexibility challenge with the UMS. It's a way to get in and trial everything that you get as a online coaching client without a subscription. It's the first time we've ever done it. Check it out. It's available on the website. At the moment, there are 10 spaces left for our first 20. We only take 20 at a time because Rad personally onboards everyone, and it's a lot of work because he has to go through a pre-exercise questionnaire with you and prescribe the right program suited to your needs and goals, and then follow up with you throughout that 28 days to make sure that you experience the full UMS experience. Check it out. Available on the website. And it's available until Friday, but this podcast is probably not going to go out until next Monday, so you'll have a few days. Anyway, take care.
See you next time.
All right, guys.